My name is Tim Long. I'm the CEO and founder of New Life Medical Centers, and today we're going to cover what's available for patients who have joint pain in the United States, whether it's knee pain, elbow, hip, shoulder. We're going to cover what's available in the United States today. There's not going to be any fluff. There's no salespeople. We're not going to send you to a stupid webinar. Like, that's the big thing right now. We're just going to tell you the simple, plain truth, kind of give you some education. So it's something you think about, something you do research with, and then go out and make your own decision without having somebody trying to sell you something. Because let me tell you, there's a lot of those out there, and we don't believe in any of that. So just be patient with us. This video is going to be probably about 20 minutes or so, but it's going to cover everything you need to know. We're not going to go into details about what a stem cell is and that kind of stuff, but it's going to cover everything you need to know to make a decision for what's the best decision for you. So what we're going to cover is what's available in the United States today, what's covered by insurance, what isn't, what are the costs involved, what are the benefits of each, what we use and what we don't use and why. So also I want to make another video about my personal testimony, because some of you patients are going to be not as bad as I was, and some of you are going to be worse than I was. But just know that I've had ACL reconstruction 20 some odd years ago with 50% of my medial meniscus, which is my left knee, the inner cartilage on the left knee, the outer edge of the cartilage, was removed. So I had an ACL reconstruction and I had bone on bone. So I've been there. I've had situations where I couldn't squat all the way down. I had to quit playing sports, anything that was high impact. I even tried to use all these different shoes. And that was just, every time I sat in the car too long or sat at my desk, I'd get stiff. When the weather would change, I would get the knee pain. It was even so bad that I'm not sure how many other people have this because I haven't talked to anyone about this specifically, but I could be sitting in the car driving, my leg kind of leaned over to the door, my knee would just go out of place, would just twist. Or I'd take my leg and cross it over the other and my knee would just go out of place. And just because the cartilage was missing, it would just slip out of place and pop, and actually people could hear it. It was painful. It wasn't crazy painful, but it was definitely uncomfortable. I would have to actually pick it up and let it shift back into place. But yeah, so I've been there, maybe something similar to what you experienced. And so most of the products I'm going to discuss today, as a matter of fact, all of them I have tried. So just to get right to it and just be patient with me, I'm going to try to get through all of them. First of all, what is covered by insurance? And most of the time, if you do have insurance and you have knee problems and you're trying to avoid knee surgery, the insurance companies are going to make you jump through hoops to get to that point. So we're going to cover these first. First is cortisone. Everybody's heard about it. Everybody's used it probably. And we use that for acute situations. We don't use that for a long-term treatment. And we don't like it more than once or twice because we know through research it deteriorates the tissues over time. It's going to make the situation worse. But if you just have a sprain or a little inflammation, you twisted it, it can help get rid of the pain, get rid of the inflammation, help a little bit. But it's not going to cure it. It's just getting rid of that immediate inflammation after an injury and get rid of that pain, but that injury is probably there and still needs to be cured or healed. Insurance will cover that. Usually you just have a copay unless you haven't met your deductible. The next one is visco supplementation. And that can range, it depends on what your situation is. There's different products for different issues like arthritis versus bone on bone. They have little gels you can inject in there, kind of give you a little bit of a cushion. But all of those, most of them are covered by insurance. And depending on what your insurance is and where you are along that process, is what your cost is going to be. Some of you, all you're going to have is a copay. So it just kind of depends. But all of those products are just temporary fixes. They're not anything permanent. They're just designed to kind of kick it down the road as long as you possibly can. And if you don't have insurance, those are very expensive, and especially for just a temporary fix. So we offer those as well. The next thing that we actually used to offer, we don't offer anymore, and I'll explain why, is stem cells and platelet-rich plasma. It's been around for decades. You guys have heard about it. It's a hot buzzword right now because you hear about, they call them stem cells, but they're really not. That's just kind of a buzzword that kind of covers everything in that industry. And we'll talk about exosomes and amniotic allograft products in just a moment. But it all started out with like platelet-rich plasma. It's been around for decades. Literally, when they started doing heart transplants, what they would do is they would take a patient's blood and they would spin down, collect all the platelets and concentrate them and inject those right on where the sutures were to help it to heal a lot faster. And it does help. with healing. That's what platelets are designed to do. Well, now they have kits for those where you can pull out a patient's blood and spin it down and capture those platelets in highly concentrated forms. Well, also, all over your body there are stem cells. There's stem cells in your blood. And stem cells is just a cell that can turn into whatever cell it needs to heal. So it can turn into a heart cell, it can turn into a tendon cell. And that's what the stem cells are for, is they float around your body and they heal. And they can turn into this to help heal along with the platelets. Well, the stem cells in your body, just like your platelets, the older you are, the less you have, the less effective they are. That's why we age. Even when we were doing it, and we would use those kits, the older the person was, the less platelets and stem cells and stuff we were able to get out of that patient's blood. So, and actually, the older you get, once you got over 50 or so, it really kind of stepped down. It was a dramatic decrease. So, unfortunately, the bad thing about it is why we age is our cells, including stem cells, are the same age as we are, and they degrade over time. And that's why we don't recover as quickly as we used to. Well, there's different ways to collect that material. One, you can collect it from the blood by just doing a simple blood draw. You can collect it from adipose tissue, which is doing liposuction, usually on the abdomen. They'll pull out fat. Or you can drill right in, usually to the hip bone, do a bone marrow. But all of them do the same thing. Basically, you collect the material, you spin it down, and you collect the platelets and the stem cells that are available, and you inject it where the injury is. So there's a couple of bad things about that. One is you don't know how many stem cells you're getting. There's just no way to know. Two, they're the same age as you are. And three, especially with the adipose in the bone marrow, it's extremely invasive. It can be pretty painful, and you're going to have some recovery time from that. But that's what's the most popular. Well, it's very popular with a lot of clinics and doctors because one, they have no cost in it. So, they just have their time and a few supplies, so that it's much more profitable for them, because you're providing the stem cells and the platelets. They're not having to get them. You're providing those. And two, because it is much more invasive and it's more complicated, and they're doing minor surgeries, and you have rehab or recovery time. The perceived value is that it must be better, and it must cost more because of all that extra effort. Well, the truth is, in research, is the stem cell, whether it's adipose, bone marrow, or rust right out of your blood, there's no difference in quantity and there's no difference in the quality, and the results are the same. The only difference is obviously the more complicated it is, the more you're going to pay for it. So that's why we don't use those anymore. I've actually had it done. I've used it. We believed in it, but there's been new products come out that are much better, much more effective, and that's why we use it. So we were going to do what's best for the patient. That's our goal, is to do the absolute best for the patient, get the patient a result. So the patient gets the result they're looking for, they're happy, and they're going to tell people about us. It's what it's all about. So we're going to use what works and what's the best. So that product is not covered, PRP or stem cells is not covered by insurance. You're going to pay out of pocket for that. I'm going to give you price ranges on it. It's anywhere in the local market, which is the West Tennessee area, is anywhere from around $4,000 up to, I had a quote for over $17,000. So it's very expensive, and we believe it definitely is not the best product out there, and that's not what's available. So again, it's not covered by insurance, and it's anywhere from $4,000 to $17,000. It depends on the doctor you're talking to and what you're getting quoted. So just know that it is available. We used to do it, but we don't do it anymore because it's not the best product. But you're going to hear that out there a lot because stem cells is such a buzzword. The next thing, and this is what we believe is the gold standard in the United States at the moment. We think there's products outside the United States that are a little better. They're not available here in the U.S. yet. We don't know if they're ever going to become available. But as far as what's available in the U.S. today, this is the best that's on the market. At least we believe that. We get the best results from this. And it's called amniotic allograft products. And what's collected is the lab, which is FDA approved, collects the umbilical cord, the cord blood, the amniotic fluid, and the placenta after a cesarean birth. Now, it's all completely ethical. Let me kind of explain how they collect it. What they do is you have a mother and a doctor who determine they need to schedule the C-section. Once it's scheduled, hospitals all around the country, the lab company works with them, they will then contact the doctor and the mother, and they will discuss, this is what we do. They take the materials, turn them into products to help heal patients or people, and the doctor and the mother agree to it. So they then test the mother, and when the mother goes in for her scheduled cesarean, the lab company's there. They will collect the materials right after the birth, and they take it immediately to the lab. And they will then take all the material and they turn it into a lot of different things, everything from for cancer patients, for bone, for soft tissue, for healing holes in the heart. They have, they can create scaffolding that will actually create scaffolding for the tissue to regrow, for bones, for burn victims. They've had situations where they can actually spray the material on the skin on the outside, and they don't get all the scarring. There's a lot of different things that they can use it for. Now, what we use in our clinic is the products that are designed for soft tissue repair, like regrowing cartilage, tendon, ligament, healing, that will rebuild the scaffolding and stabilize that joint. So whatever's needed in that joint. So that's the products we use, which is called an amniotic allograft product. And we believe, without a doubt, that that's the best product out there, not only because we've seen it, but we also understand the technology and the research behind it. What's great about it is, one, the cells, whether it's the mesenchymal cells, which turn on the stem cells, or the growth proteins, or the cytokines, all that material is only 2 days old. So it's not 40, 50, or 60 years old, it's only 2 days old. So it's much more effective in helping a tissue recover or rejuvenate. Two, there's no, it's not invasive whatsoever. It's not much more than really simply a simple injection. What happens is when we schedule the appointment, we order your product, so it's only a few days old. It comes in frozen, and we unfreeze it, which takes typically 3 to 5 minutes, and then we draw it up into an injection, and we inject it directly into the joint. The pain is no more than it would be for like a cortisone shot. So I'm not saying it's pain-free, but it's not very painful. We even numb the tissue on the outside, and we do a lot of things to kind of help with that. But it can be painful, it depends on the patient, but usually it's not very painful at all. As far as recovery, as soon as you're done with the injection, you stand up and you go back to work. Or in my case, like I cover in a personal testimonial in a separate video, I went straight to the gym. So it's virtually no downtime whatsoever. The only thing we're going to tell you to do is, for the first 30 days, not to do anything high impact on that joint. Like if it's a knee, don't go running or jogging. You walk as much as you want to, as much as you need to, climb stairs, whatever. Just don't do anything high impact, and or don't lift anything extremely heavy. It doesn't mean you can't go work out. It just means you're going to try to work around that joint, or if you do, you just do something very, very lightweight just to get blood flow through it. But give that tissue time to grab hold, start to grow, and start to heal. So the downtime recovery is almost nothing. And just so you know, those other treatments we talked about earlier, it's going to be very similar to that. They're going to tell you to stay off, don't do anything high impact, yada, yada, yada. So the recovery is almost nothing. Now, it's not covered by insurance, and the cost is, and we can do finance as well, and even interest-free. The cost can be as low as like $120 to $150 a month, depending on your situation. But the cash price out of pocket is anywhere from $3,800 to around $5,800, depending on what you're needing or how many joints you're doing and so on. So those are the realistic prices that you're going to see. And because we don't like any surprises or gotchas, we want you to know exactly what you're getting into and understand it up front. Because no one here is going to try to sell you anything or pressure you. So that's why I'm telling you everything in this video, so you have everything you need to know. You know what the costs are. You've made that decision on your own. You just want to come in and get a few more details and then solve the issue. So all these products I talked about today, we have used in the clinic. Some of them we still use. Depends on if they're covered by insurance or not, what your patient's wanting. Like I said, with the stem cells and peer, we stop because we believe there's a better product out there. But they're all available if you need those. So whatever you're looking for, whatever you're needing, we can help you with it. So hopefully this has answered a lot of the questions. If you have any questions, feel free to contact us. We'll be glad to answer as many as we can over the phone or through an email. However you want to reach out to us, we're more than happy to help you in any way you possibly can. So if you're ready to get rid of the joint pain and you're just kind of sick and tired like I was, you want to kind of get back to normal, and you want to maybe possibly heal it instead of just kicking the can down the road, and you want something more permanent, give us a call. We'll be glad to help any way that we can. So if you have any questions, let us know, and hopefully have a great day.